Pregnancy can be a scary time, and especially in the middle of a pandemic. So to put any concerns to rest, today I'm going to be speaking to Dr. Filomena Meffe. She is the Chief of OBGYN at St. Michael's Hospital. Dr. Meffe, thank you so much for joining us. How are you today?
I'm fine, thank you very much. And Camila, thank you for inviting me to do this interview with you. As you said, it is a scary time for pregnant individuals, and I hope that this kind of information will help to give them some reassurance about COVID-19 in such uncertain times.
And I think one of the biggest questions that pregnant individuals can have is, what is the situation like right now in the hospitals and delivery rooms and appointments? Can my partner come? Can I feel comfortable going to the hospital? So what would be the best answer for a concern like that?
Well, I would like to reassure the public that it is very safe to come into your appointments and to come to hospital. And pregnancy needs to be monitored, and it can't all be done over the phone or virtually. So there are some very important appointments that need to be done in person. And I just want to reassure everyone that it is safe to come. I wouldn't want somebody to ignore concerns about their health during pregnancy and then maybe not get the care that they need and have an outcome that is unexpected, that could have been avoided. So yes, I would want to encourage the public to come in for their appointments. What will it be like? Of course it's different. We have to abide by public health guidelines in terms of social distancing. So in pregnancy, what we've done, particularly for the low-risk patients, is to combine virtual appointments with in-clinic appointments so that we reduce the number of patients that are in waiting rooms. This can be done very safely. We've been doing it for almost a year now, and it's been going very well. Of course, when an in-person visit is needed, it will be done because we want to make sure that we're tailoring to the needs of our patients. We wouldn't want to miss anything. The essential partners, however, are not allowed to come in for these clinic visits unless there's a real need for them to be there. There are mobility issues, or the patient just requires that extra assistance from their partner. That is disappointing for many women, individuals who are pregnant and pregnant women, because this is such a special time of their life to be pregnant and expecting a baby. But for the safety of the healthcare providers and the other patients that are in clinic, this is very important.
And with this new second lockdown, is that impacting at all the delivery room? Can the partner be present for the birth?
Yes, I mean, we recognized right from the start how important it was to have an essential care partner with, women in labor, pregnant individuals in labor. So we allowed that essential care partner to come in with our patients right from the beginning. Of course, they will be screened at the entrance. You will be asked to wear a mask and do hand hygiene. There will be a second screening at the entrance to the labor and birth unit. And of course, I'm speaking about what happens at St. Michael's Hospital. Every hospital may have their own individual essential care partner policies. But as for St. Mike's, this is our protocol at the moment. Once the couple arrives, they'll be escorted into a room. And what we hope for is for the partner and the pregnant individual to be staying in their room as much as possible. The partner will be allowed to stay for the entire labor and birth and the postpartum period, and then will be discharged alongside their partner. And that is really how things are happening at the moment. Will this change? It's uncertain. At this point, we are able to maintain this policy. We know it's really important for pregnant individuals in labor to have the support of their loved one next to them. We know that labor will go more smoothly in situations like that. We've had a lot of experience now all over the world. And what we understand is that pregnant individuals are at no greater risk compared to the non-pregnant population of contracting COVID. So I just want to make that clear. However, what we have learned is that if you are pregnant and get COVID, you are at a higher risk of developing severe symptoms. to the point where you may require admission to an intensive care unit, or you might require a ventilation. So we have learned that over these last several months. It wasn't clear in the beginning of the pandemic that that was the case.
And what would be the best recommendation then? Obviously, we've all heard the health guidelines of wearing a mask, washing our hands, but if you are in that situation where you are expecting a child, how can you further reduce the risk of potentially being sent to an ICU?
Mm-hmm. Well, I think following the public health guidelines is a really good place to start. Following these directives, wearing a mask, hand hygiene, social distancing. But it's also really important for each family to assess their own situation. We know that that's not entirely possible in every single situation. Families may have young children who are going to school, and that might present another challenge for them. Or they can't completely socially isolate. There may be factors within that household, such as mental health issues or other concerns where the family needs support. So I think that each family has to make their own assessment on this, and to be as safe as possible. We have to do the best that we can. Another thing I would advise is, as patients are getting close to the end of their pregnancy, they may want to consider, well, how can I make it as safe as possible? Only, leaving the home for very essential visits, or having someone else do the grocery shopping or the pickup of children from school, or trying to really prepare yourself for the labor and birth, and trying to minimize your exposure in whatever way is possible. But we know it's not going to be perfect.
And you did mention that in the last few months, there have been a bit more access to realizing what it is that affects pregnancy and what doesn't. Does an earlier term positive COVID-19 test cause more risk to the baby, or a later term? Does it matter at what point in the pregnancy you might test positive for COVID-19?
Yeah, I don't think it's clear if women are more susceptible in early pregnancy or late pregnancy. I don't think we have that kind of information. What we do know is if patients get COVID early in pregnancy, there doesn't appear to be an increased chance of miscarriage. There doesn't appear to be an increased risk of the baby being born with an abnormality. The risk, however, seems to be a little bit more in later pregnancy. So if a woman was to get COVID later in pregnancy, then there are more issues that may arise in terms of severity of the symptoms, maybe requiring an earlier delivery that might lead to preterm delivery, an admission to the ICU, NICU, neonatal intensive care unit for a baby. So later in pregnancy, it seems to be more of an issue. And we understand that we have to monitor the pregnancy more closely after a patient has contracted COVID. Within the first week of those symptoms starting, we know that patients may complain of decreased fetal movement. And so it is recommended that if you contract COVID later in pregnancy, monitor the baby's movements, contact your healthcare provider if you feel that there's a problem. Do not hesitate. And on our side, as the healthcare providers, we're going to monitor the pregnancy more closely. It is recommended that we do ultrasounds to monitor the baby's well-being and growth every month until birth, after a woman's contracted COVID in, let's say, the third trimester.
And as the vaccine starts to roll out, I think vaccines in pregnancy have always been a cause for debate. Will pregnant women be advised to take the COVID-19 vaccine?
Well, this is a really timely question because the vaccine is here. And it has been recommended by the National Advisory Committee on Immunization, a Canadian committee, that pregnant women, breastfeeding women, should not be routinely offered this vaccine. And the reason for that is because the trials were not conducted in pregnant individuals and breastfeeding individuals. However, the healthcare providers don't necessarily agree with that recommendation. We you know, pregnant individuals actually, many being women, of course, are at the forefront of this healthcare crisis here. They are the nurses. They are working at the, you know, other healthcare providers. They're working at the front lines. They are susceptible to COVID. So we think that actually pregnant and breastfeeding women should be considered for the vaccine. And it should be a discussion with the healthcare provider. What are my personal risks? What kind of medical conditions do I have? What kind of work am I doing? Am I at high risk? I think, you know, pregnant individuals need to make that decision for themselves with their healthcare provider as to whether they want the vaccine or not.
And Dr. Meffe, I would love to know what has been the biggest myth or a theory that you've heard related to pregnancy and COVID-19 that you think needs to be addressed and debunked?
Well, I guess if I had to choose one, I think I would say that, you know, initially we felt that pregnant individuals and their babies at birth needed to be separated if the parent had contracted COVID. And that was certainly the case early on in China and in the US. But what we have learned is that mother-baby pair is so important to the health and well-being of the parent, the mother, and the baby. And in fact, even if mom did have COVID, the risk of the baby getting COVID is extremely low. And even if, you know, baby did get COVID, the symptoms are very mild. And so tearing these two people apart at a very crucial time of their life is not very helpful. And so we've learned that as long as mom, you know, wears a mask, does hand hygiene, cleans the breast area before breastfeeding and after breastfeeding, that bond is really important. The skin-to-skin contact, the bonding between mother and baby is so beneficial for the mental health of mom and for the growth and well-being and even the quality sleep for baby.
Dr. Meffe, thank you so much for all of this useful information and for all of this advice that I'm sure is really helping all of our viewers.
Okay, thank you so much for the invitation, Camille. I really appreciate it.